Regorafenib in the redose data was used as indicated in patients with refractory colon and rectal cancer to other standard chemotherapies, i.e. full FOXFOLFIRINOX treatments plus or minus Avastin, et cetera, et cetera. This is a very difficult population to treat. It's a population that's highly resistant. And one of the issues we were having with Regorafenib was that starting at the standard dose, at the dose that was studied, a lot of patients had to hold off on treatment, or did not want to continue on treatment, and therefore we had to move on to a different possible regimen or combination or single drug approach in this refractory patient population and our clinical trials. What redose, one of the questions we have is, well, if we're not starting at the full dose, are we going to get the same benefit, or perhaps even having no benefit plus having same or worse or same toxicity, or not being able to help our patients? What the redose study showed us was that in this patient population, if you start at 80 milligrams daily dose, and then see the patient's tolerance and titrate. If the patient is tolerating, titrate up, and if the patient has some toxicity, perhaps hold off, but continue to titrate up until tolerance. That in that patient population, the overall survival of this patient was quite dramatic, I should say. We're talking about overall survivals of upwards of over 8 months in this patient populations and beyond.